Hi, my name is Justine Fletcher and my presentation is on Parkinson's disease, which can also be referred to as PD. And Parkinson's disease is a degenerative neurological disorder that affects the even movement of our bodies. This happens when not enough dopamine is produced in the brain due to the cells dying off. And dopamine is a neurotransmitter that is responsible for those even movements of our body, so walking and bending and things like that. It can affect many ages of people, but it does tend to generally affect elderly people, with 1% being over 60 years of age. Symptoms of Parkinson's disease can be tremors, like we see in the celebrity Michael J. Fox with Parkinson's disease, rigidity, which is muscle stiffness, and bradykinesia, which is known as the sluggish and the lack of movement of the body. These symptoms can range from mild to extreme, and that'll also help determine what stage of Parkinson's disease, what stage they're at with Parkinson's disease, so the early, the intermediate, or the advanced stage. Detection of Parkinson's disease is quite difficult, as other health problems can mimic that also. So from your initial appointment to your doctor, he refers you on to a neurologist who will set out a series of exams to sort of evaluate your coordination, your walking, and your fine motor skills, such as using your hands. There can also be brain scans and lab tests that can occur also. That's mainly to eliminate the other health issues that can mimic Parkinson's disease. There is no cure and prevention to date. However, they do believe that people with juvenile Parkinson's disease, so those that suffer at an early age, tend to have more of a genetics-related case, where the elderly, there's still no definitive answer. When having Parkinson's disease, life can become quite difficult, so there'll be many IPE teams involved here with the care of a person with Parkinson's disease. So as mentioned, you've got your doctor who refers you to a neurologist. He can also prescribe medication to help with some of the symptoms of Parkinson's disease, so your pharmacist will come involved there. Medication will be an ongoing thing for a Parkinson's disease patient, and so that's basically a monthly trip sort of to your local pharmacist. As mentioned, with the sluggish and the lack of movement and the stiffness of muscles, a physiotherapist would be quite beneficial here to sort of help with activities to keep those muscles moving. Can also help with the pain aspect by using equipment and also massage. They'll also be able to help with putting equipment around the home to help with things like getting out of bed, having a shower. That's just everyday living activities that we all sort of take for granted. As a person with Parkinson's disease has trouble in the later stages of speaking, they'll also have trouble with swallowing, so they'll also be drooling. So a speech and language therapist is quite beneficial here. And due to the swallowing aspect, a dietitian will need to be involved here, because the diet will have to change, because chewing a steak and swallowing a piece of steak just would be really quite impossible for a person with the advanced stage of Parkinson's disease. So a dietitian is handy. There tends to be a lot of health impacts on a family and a person with Parkinson's disease. Co-workers, family, friends, they're all there that will have to help support that person with Parkinson's disease. There'll be a lot of frustration and aggression, and those people will sort of need help to deal with that also. So social workers are quite good to help with the impact of Parkinson's disease with family, friends and co-workers and the individual. Well, I hope you've all learned a little something from Parkinson's disease, and thank you very much.